Hi, my name is Hunter, and today I will be performing the skill of prenatal education, health, pregnancy. So I wanted to, I have my badge on here, school appropriate scrubs, and we will dive right in. So I wanted to just start by saying there's 3 trimesters when we are talking about pregnancy for a female. So we're going to start with weeks 4 to 28, and this being the first trimester. So generally, the doctor's appointments are going to start at 4 weeks and or when the individual finds out that they are pregnant. So in this first appointment, we are going to do a review of history, review family history, patient history, previous pregnancies, risk factors, and also any past surgeries. In addition, we're also going to do a full set of vitals, height, weight. For labs, we're going to take a CBC. We're going to do the HCG for the pregnancy levels, blood type, HIV. We're going to do an ultrasound, pelvic exam, pap smear. And then also we're going to, in this appointment, we're also going to determine a due date for the baby. At about 10 weeks, this is when we're going to use a Doppler to check the baby's heart rate and also begin measuring the fundus height. And this is going to help us adequately measure the baby's growth in progression. So that's kind of first trimester. Going into the second trimester is going to be weeks 13 to 28, and this is where routine checkups plus optional genetic testing is going to take place. And there's five potential tests that we could potentially run. So we're going to do an NIPT, a quad test, and this is going to be testing for Down syndrome, an AFP, which is also going to test for neural defects, the amniocentesis for genetic abnormalities, and then also the CVS for genetic abnormalities. Now, it's also important to note that not every individual is going to opt for these genetic testings. It's just going to be as an option. At 20 weeks, this is where we are going to find out the sex of the baby. So this is where we're going to do the fetal anatomy scan and the gender reveal. Excuse me. Weeks 28 to 36, this is going to be the third trimester. And we're also going to be doing the routine checkups. What's going to take place is, again, in these routine checkups is the routine work. But we're also going to recommend, this is where we're going to recommend the TDAP vaccine, Rhogam for Rh positive or Rh negative mothers. And then we're also going to do the 1-hour glucose tolerance test to ensure that the mother is not developing any gestational diabetes. So weeks 36 to delivery, this is where we are going to move to weekly checkups. Again, routine care, assessing the baby's position, the cervix, education and signs on the labor contractions, and the water breaking. And that's my summary in a whole of like pregnancy to term, the appointment schedules, and then what is to kind of be expected throughout. I would like to kind of dive into nutrition. So nutrition is really important throughout pregnancy. And we need to make sure that we're properly educating the mother on nutritional intakes, and that way she is nourishing her baby and the baby is able to get certain vitamins and minerals throughout pregnancy. So it is recommended to increase the calories by 300 per day, ensuring that we're getting enough proteins, fats, carbohydrates, with plenty of fruits and veggies in addition. So foods that we're going to, or supplements, vitamins and minerals, we're going to want to recommend are iron-rich foods, so meats, dried fruits, potassium such as bananas, vitamin A, carrots, sweet potatoes, spinach, vitamin C being orange juice, calcium, dark leafy greens, and then supplement recommendations that we're going to make, number 1 being folic acid to prevent neural defects, and we are going to recommend 500 milligrams per day. And this is going to, again, aid in the neural defects such as spina bifida. So grains, nuts, beans, etc. And I think I said 500 milligrams, but I meant 500 micrograms. No, sorry. For folic acid, it's going to be 400 micrograms recommend. And then also omega-3 fatty acids. When we are doing educational interventions, we want to also teach the mother that we also want to teach the mother to avoid certain foods, being unpasteurized milk, raw milk, brie cheese, egg salad from like the deli, any kind of excessive salt, butters, etc. Super processed foods, things of that nature. As far as exercise go, we're going to want to encourage low impact exercises such as yoga, swimming, walking, avoiding any type of contact sports and or anything that's going to put stress on the mother and or put the baby at risk. Not doing any sports and or exercise activities that could potentially put the mother at a fall risk. It is recommended that the mother exercise at least 2.5 hours a week. As far as weight gain goes, I'm going to break it down from underweight, normal, overweight, and then obese. So generally speaking, when going through pregnancy, everyone is going to gain weight a little bit differently depending on how much weight that they're already carrying. And so if we're speaking an underweight patient individual, a BMI of under 18.5, generally a healthy amount is going to be 25 to 30 pounds. Normal BMI being 18 to 24, again 25 to about 30 pounds recommended. Now if a patient is overweight, we're going to want to in the BMI say 25 to 29, 15 to 25 pounds is going to be a healthy amount for the mother to gain. Now if the patient's obese, BMI over 30, it is recommended between 11 and 20 pounds. Now again, this is just going to depend on the mother prior pregnancy, pre-pregnancy weight, so 3 common complaints during pregnancy are going to be one being nausea and vomiting. So a method to relieve would be to keep snacks on the mother, and or opt for foods that are bland that aren't going to cause any type of food aversions. Stretch marks, that's a big one. Certain lotions that you can purchase that could potentially aid in relief of this. And then constipation, and the relief is going to be increasing fluid, fibers, and then also movement. And again, fiber is going to be a big one as well, and also fluids. 3 warning signs. 3 warning signs to teach, which the patient would need to call their provider immediately, is going to be one leg with redness. Any kind of redness, swelling, pain is going to indicate possible DVT. They need to call the provider immediately. Severe headaches could be indicative of preeclampsia, so high blood pressure, again, needing to call the provider immediately. And then severe lower abdominal pain could also be indicative of a placental abruption, and that is when the placental is prematurely detached. So that is my prenatal education health pregnancy.